Hello, everyone. On behalf of United Way of the National Capital Area and the entire staff, welcome to Project Community Connect. I'm Katie Muir, Community Impact Manager for Health. United Way National Capital Area expanded its annual Project Homeless Connect in response to the COVID-19 pandemic and to align with its strategic programmatic direction focused on achieving equity for all of our community members, regardless of their race, gender, income, and ability. We're excited to work with our partners and community-based organizations on PCC's mission to build community, shift mindsets through personal experience and connection, and provide critical resources at no cost to individuals and families in Washington, D.C. and surrounding counties in Maryland and Northern Virginia. Workshop topics for this week include healthy eating on a budget, eviction prevention and rental assistance, starting a small business, legal services in the areas of expungement and housing, and several others. In this time of COVID, there is no segment of society that has not been touched by this public health crisis, particularly those households who are struggling to afford the basic household necessities, including housing, childcare, food, transportation, healthcare, and even a basic smartphone plan. In this unprecedented time, and as we all continue to navigate uncertainty, it remains imperative that your United Way provide innovative ways to reach workers and their families throughout the DMV. Today, I'm joined by Dr. Kyndra Jackson from the Mary Center to bring you Let's Fight COVID Together. Please join me in welcoming Dr. Jackson.
Thank you so much, Katie, for that introduction. I am so excited to be part of this great event, and I hope that our talk today gives you a few tools to put in your toolkit as we continue to fight through this global COVID pandemic. So the information and resources we share today will help you continue to protect you, your family, and your loved ones. As we go through this talk, I would ask that if you have any questions, please save them for the end of the presentation when we have our question and answer session. Next slide, please. So let me tell you a little bit about me. So I'm recently retired Army veteran with over 20 years of service. I'm also a registered nurse by training, and I've been involved in public health for about 15 years or more. In my current role, I work with churches in Maryland and DC as they take the COVID education message out to the community. With COVID being such a significant public health concern right now, we need everyone to get involved to promote and share credible information and resources, and also help us assist in eliminating any barriers to testing and vaccination. And our local churches have been doing a great job of supporting that effort. So I'm proud to be part of that work and supporting the Choose Healthy Life program. Next slide, please. So here is our agenda, just the wave tops of things that we'll be discussing today. So first, we'll just talk about some COVID-19 101, some basic, just general facts about what this disease is, what are the statistics looking like right now, COVID prevention and management. So what happens if you do get it? What are some things that you can do at home to lessen your risk of spreading it to others and making sure that you get on the path to getting well again. Then we're going to talk about vaccine safety. The vaccine we know is probably the best tool that we have to fight COVID. And so we want to make sure that you have the information that you need so that you can make a informed decision for yourself, your family, and you know that you're doing the best thing that you can for your loved ones and your community. And then we'll talk about some COVID myths, because we know that there's a lot of folks that are still unsure about the vaccine, maybe unsure about its safety. Maybe there's some other concerns that you have. So we'll talk about some common myths that are out there and hopefully dispel any misinformation you might have heard, again, to help you so that you can make an informed decision. And then lastly, we'll talk about resources. So at this point, access to the vaccine is very prevalent. We have a lot of locations across the district in Maryland and Virginia where you can get access to the vaccine at no cost. So we want to make sure that you have some of those resources available to you, again, so that you can equip yourself, equip your family to get that protection, that extra layer of protection that we need during this pandemic. Next slide. So what do we know about COVID? COVID-19 results in a range of illnesses. Primarily, you'll see people have mild symptoms all the way to very severe illness and death. So when we're talking about moderate and severe illness, that is to the point where you can't manage the symptoms yourself at home and you've got to go to the hospital to get additional care, which is extremely difficult when you're talking about COVID itself, which is a respiratory disease. Usually when people start showing symptoms, they'll see them between 2 and 14 days after they've been exposed to the virus somewhere out in the environment. And when people have symptoms, a lot of the symptoms include fever or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches. They might have headache. There's also a lot of people that might have a loss of taste or smell that is just, they feel like it's out of nowhere. Sore throat, congestion, runny nose, nausea, vomiting, and diarrhea. So I know those symptoms, can also look like a lot of other disease processes. But now that we're in this environment of COVID, we also want to make sure that you do your due diligence to figure out, what is that? Is it a cold? Is it flu? Is it COVID? Because they all have very similar signs and symptoms. That's why, again, it's very important that you find ways that you can go ahead and get a test so we can make sure we can figure out exactly what it is. And then we will be able to help you manage that if you do have these symptoms yourself, or someone, or you're caring for someone that is having these symptoms. With these symptoms, or with COVID, we have a group of people that have symptoms, but then we also have a group of the population that don't have any symptoms at all. So about 30% of the people that get COVID or test positive for COVID actually don't have any symptoms. No one can predict how severe a person's illness might be. It just all depends on the health of that individual, what other diseases they might be fighting, the level of exposure of the virus. All of those are taken into account to see if someone will actually come down with the virus or not. But some people are more likely than others to become severely ill when infected. And the research, the data is showing us that's usually our older people, our elderly population, and then adults or people that have certain medical conditions, because their body is fighting off those medical conditions as well. And then when you add COVID on top of it, that makes it more of a burden. So some of those other medical conditions might be diabetes, obesity, cancer, or heart disease. Next slide, please. So COVID is still around every day. We have new cases every day, and we have people still dying every day. So globally, looking at the big scale, right now we have about 242 million cases of COVID. So around the world, we've had over 242 million people test positive for COVID. And we've had 4.9, almost 5 million deaths attributed to COVID. I mean, that is huge. So these numbers here on the slide are actually what COVID looks like right now, some of our data in the United States. And this data was posted on the CDC website as of October 20th. So we have over 45 million cases and over 700,000 deaths in the United States alone. And if you were to go to the CDC website right now and click on where this data and the statistic lies on their website, I'm sure you'll see the numbers have changed, the numbers have increased, because every day we're seeing an increase in number of cases still. Next slide, please. So this is what COVID looks like in our community. So these numbers are from also, I believe, data of the 20th of October. And so you can see what the district numbers look like. So over 63,000 cases and 1,100 deaths. And in Maryland, they've had over 550,000 cases and 10,000 deaths. And in Virginia, over 900,000 cases and over 13,000 deaths. So again, this is when we look at our communities and where we live, where we work, where we play, where we socialize with our families and our social networks. COVID is still running around as well. So you've got to make sure that you're staying vigilant, you're staying aware, and you're doing all of the protective things you should be when you're around your coworkers, your families, and your friends. Next slide, please. So now we're going to look at impacts on communities racially. So when we look at the impact of COVID on certain communities, we see that our Black and Brown communities are being hit harder with COVID, hospitalizations, and deaths. So this graph shows the risk of hospitalization and death compared to the white population in the United States. So what this graph is showing us that our Black and Hispanic communities are 2.8 times more likely to be hospitalized from COVID and 2 to 2.3 times more likely to die from the disease. Now, there are a lot of factors that go into this. Of course, income, how much money people make, because all of that is linked to people's access to health care, who can get the health care in a timely manner versus who can't. Also, exposure to the virus due to people's occupations. So what the research is telling us, we have a lot of folks that are in the Black and Hispanic communities that what we consider are frontline essential workers. Those are those folks that are working out in the community, out in the environment all the time, because they have those particular jobs that we need to keep the world moving. There are, postal workers, maybe grocery workers, healthcare providers, people that are working in the daycares, bus drivers, other transportation workers, construction workers. These are people that are working in environments where, working from home is really not an option. That is not, because of the nature of their jobs, they can't go and have opportunities to stay at home and do their jobs because they got to go out and they're working out in the public or out in the environment or out with other people. And because of that, they are being exposed a lot more to COVID virus as well as a whole host of other viruses just because they're interacting with people all the time. So that has a lot to do with, of course, their risk as well, because you're constantly being exposed to all the germs that, everyone is carrying around when they're out and about, out in the community. But you know what? They got to get a job. They got to keep getting paid. So they're going to continue to go to work. You guys are going to continue to go to work. So with that, knowing that the type of job that you have potentially might expose you to COVID and other things a lot more, it is really imperative that you look at your risk and you look at the types of jobs that you have along with those other factors and start tying that into the research, the things that we're talking about today and the research that you're doing on your own about maybe the COVID vaccine and the COVID risk and severity, and make a good choice for you to put all of those protective factors in line. And we hope vaccination is part of that, and that you get your vaccine so that you have the greatest level of protection for you and your family just because of the hard work that you guys are doing out in the communities. We know that you can't, not stop working. And since we need to keep you out in the workforce, we want to make sure that you are staying completely protected. Next slide, please. So what about this Delta variant? And we've heard a lot about the Delta variant for some time now in the news and in research and on websites. So viruses constantly change through mutation, and new variants of a virus develop. Sometimes they develop and then they disappear. And then sometimes when new variants come along, they stay. So that is exactly what the Delta variant has done. So this is a mutation or a change of the original COVID-19 virus that we saw when things first started back in 2020. All of the variants, so Delta is not the only variant out there that we've seen for COVID-19. All of the variants of the virus that cause COVID are being tracked by the United States and globally during the pandemic. The Delta variant is highly contagious, and they believe it's more than 2 times as contagious as the previous variants. And the greatest risk of transmission is among those folks that are still not vaccinated. Because they're unvaccinated, they're much more likely to get infected, and then they're much more likely to transmit the virus to other people. I know you've also heard, well, what about these breakthrough cases and things like that? Yes, fully vaccinated people can also get COVID-19, but it is less often, much less often than unvaccinated people. People infected with the Delta variant, including those who are fully vaccinated, can also transmit the virus to others. But what we're seeing with some of the data is that those that are infected and have been vaccinated usually will spread the virus or be infectious for a shorter amount of time. So that's why, again, it's extremely important to consider vaccination if you have not been vaccinated, so that, even if you happen to get the virus, which will still be a lot less of a risk if you're fully vaccinated, if you do happen to get vaccinated, you will be able to transmit the virus in a lot shorter period of time. You will be infectious for a shorter period of time. Therefore, you won't be infecting others around you for as long of a period of time. Variants are expected, but the best way also to slow the development of new variants is also by vaccination, because vaccination helps reduce the variants by killing the virus before it has a chance to replicate. So early and proper vaccination will reduce the ongoing development of variances. So that is another positive for the community of why we want to get everybody vaccinated. Next slide, please. So how do you prevent COVID? So I call it, I guess, if you want to, we've got this protection triad, if you will. The three core things that we want to think about when we're talking about prevention is, number one, get your COVID vaccine. It is extremely important. And then you also want to continue to be wearing your mask. You still should be wearing masks in indoor populations when you have a lot of people that are around. It is highly recommended that you can continue to do so. If you're still in a school environment, your kiddos are in school, probably there are requirements that the children wear masks when they're in a classroom setting, which is what we want to do, because it's very difficult for the kiddos to be socially distant just because of the space and where they are. So again, I think a good rule of thumb overall is that if you're in places where you really cannot maintain your social distance and you're indoors and you don't have maybe the best ventilation and things like that, continue to wear your masks. And when we're talking about wearing masks, it is not one mask forever. So please, do your due diligence. Try to find places where you can get if you're using disposable surgical masks, make sure you are able to have an ample supply so that you can use them as directed. You shouldn't be using the disposable mask for like a week or 2 weeks at a time before you toss them. You want to be changing them out on a regular basis, having a fresh mask, because you want it at the peak performance so it can work and protect you. Also, if you're using cloth masks, make sure you're washing them on a frequent basis, on a regular basis. So have 5 or 6 or 7 or 8 different masks that you can use to take you through your entire week, so that you have a chance to wash them, get them cleaned up before you put them back into your cycle of use. So you shouldn't be using your cloth masks for a week or 2 weeks at a time before you finally put them in the wash and get them clean. So please make sure you're doing that. Also, you want to avoid close contact with others. So it's still important to do that, what they call social distancing. It's extremely important. So they use the guideline of at least 6 feet if you're able to do that. But I know that is a very unrealistic in a lot of situations. So again, you do the best that you can based on the situation that you're in. And that's why we always encourage your mask use as well if you're not able to keep that social distance. Again, avoiding large crowd, places that don't have a lot of ventilation, where air is not flowing well in and out. Also, again, washing hands often with soap and water. That is pretty much the hand hygiene strategy is what we use, not just for COVID, but we use that for any type of germs we're trying to protect ourselves from. Make sure you're washing your hands often. Make sure you're using soap and water. Make sure you're washing them for 20 seconds or more before you're rinsing and finishing that process. Because that is how we keep ourselves just overall healthy from a lot of different things. If you have handy, again, keep a supply of alcohol-based hand sanitizer with you. You want to be able to have that available just in case you can't get to soap and water. Again, that is a great alternative to keep that with you, because you might be in settings where, your hands get soiled for whatever reason. And, that's the next best thing that you have is that alcohol-based sanitizer. So you want to keep that handy. I know it's very hard. They have a lot of your eyes, your nose, your mouth. We touch our face a lot more than we think about it. So really trying to get into the habit of keeping your hands away from your face is extremely important, because these are a lot of ways of how you can have germs enter your body and through that exposure. And we do that when we haven't washed our hands, or maybe they're, soiled, and we go up and then we touch our eyes, or we rub our nose, or, we do something with our mouth, and now we just introduced that germ, into our system. So again, if you're able to, just be mindful of, try to keep your hands away from your face, because your face is a very sensitive area in which a lot of germs and things can enter through that area of your body. And then when you're talking about, again, overall keeping your spaces and your household clean, you want to make sure that those highly touched areas in your home, you're cleaning and you're disinfecting them very often. So, doorknobs and remotes and phone handles. And if you have, a desk station at work, you're cleaning your keyboards and your mouse pretty frequently, and thinking about those areas in your spaces, your home space, or maybe your workspace that are touched just, frequently because of day-to-day use. You want to make sure you're taking some extra time to keep those things clean and disinfected regularly. Next slide, please. So what happens if I actually get COVID? So again, the first and foremost is we want to make sure that you know what you need to do to get yourself on the mend. Make sure that you are in touch with, some type of support system to hopefully help you through these few days where you might be down just because you're not feeling well. But these are some good strategies that you can do while you're recovering at home, so that you can keep yourself, safe and healthy, and make sure that you're not transmitting the disease to anybody else. So if you're living, with your family, maybe your spouse and your children, or you're living in conditions where, there's a group setting, there are certain things that you can try to do so that you can mitigate the risk that we're not going to end up with more people getting infected. So always, again, going back to cleaning hands with soap and water regularly, being very vigilant with that, and alcohol sanitizer. And if you're able to, if you're living in a home with different bedrooms and you can make a shift, we would prefer that people that are feeling ill and feeling sick and are able to stay in their own separate room, so that you can keep yourself as far enough away as you can from the rest of the people in your family. I know that's not always possible, but that is the preference. So if you do have an extra room or a spare room that you can separate yourself from the other people kind of in your family or the people that you're living with, that would be the best case scenario. If you can't, continue to wear your surgical mask indoors and practice that social distancing as best as you can within the space where you're living. You need to stay home. Again, I know that it's hard for some folks, but if you are sick, and again, we would ask you to do this not just with COVID, but with any kind of germ. If you had the flu, if you had a cold, stay home, get your rest. Don't go to work, don't go to school. You shouldn't be going out to public places. Really try to rely on somebody if you can to help you with, getting certain things, if there's things that you need, really do your best to stay home as much as possible. However, if you can't, you know, please make sure you're practicing your safety precautions with wearing your mask, trying your best to social distance if you were really had to go out during this time. But the guidance and the recommendations are that you stay put and focus on you getting back to 100%. You want to rest, drink plenty of fluids, and try your best to be eating nutritious food, because all of that impacts how you're able to bounce back and recover from this disease, from this virus. So, again, if you have someone that can help you out with that, to make sure that you've got plenty of fluids, water, your chicken soup, whatever you need, really reach out to those support connections that you have and help you get those things. Again, if you don't have all of that, these are the things that you want to try to make sure that you're able to stock up for yourself. Is stick with the water, stick with the Gatorade, stick with the nutritious foods to help you with your recovery. When you're coughing and you're sneezing, again, sounds simple, but some people need to be reminded to do that. You want to cover your cough, and not cover your cough with your hand. You should be covering your cough by, coughing into that bent elbow, or use a disposable tissue to cover your mouth, sneeze, do whatever you need to do, then go ahead and discard that. And then make sure you have access to additional health care if things get worse. You don't want to suffer in silence when you have this virus. Sometimes people see things progress pretty quickly and they're feeling okay for the first couple of days. But if you're starting to feel that things are not getting better, you're having especially difficulty breathing, more of a cough, fever, certain things just aren't getting right, make sure that you get medical attention. So, find, if it's your personal healthcare provider, find someone else that you can reach out to that can provide you, urgent care, whoever it is for you. Make sure you have contact with a doctor or a healthcare facility, so that if you need some additional assistance because symptoms get worse, you can get that in a timely manner. Because you don't want to sit and delay that. If you're truly not feeling well and you feel like things are progressively getting worse, make sure that you get medical attention. Next slide, please. So after talking through all of the symptoms and going through COVID, that is one way to build immunity and build a protection. Is that once you get the virus, your body will develop some level of antibodies. However, vaccination is a safer way to build protection. Getting the virus may offer some natural protection. That's called that immunity. But we don't know how long that protection lasts. And the risk of severe illness and death from COVID still far outweighs any benefits from natural immunity. And so that's why we are really encouraging COVID vaccination for everybody, because we know that is going to get you the highest degree of protection without you having to experience those those symptoms from COVID or getting severe illness to be able to obtain that immunity. And the recommendation is for those folks that have had COVID is that they still, after they've had COVID, they still consider getting the vaccination, because that vaccination is still going to provide them with a higher level of protection than that natural immunity alone. So again, we know that vaccines work. We've seen it with a lot of other diseases that we have vaccines for, and we know that the COVID-19 vaccine is just the safer way to be able to build that protection for our community, and then hopefully stop these the transmission, so we're not seeing the variant and we're not seeing our community and our family and our loved ones continuing to get sick in such a severe way and end up in the hospital or even worse. So again, the way to go, everyone that I've talked to, the people that I know that have personally had COVID, and then have gotten the vaccine afterwards. They would have much rather just gone through kind of those what they call side effects from the vaccine versus personally having to go through COVID itself. You know, COVID is no joke when you're having some of those symptoms and are unable to breathe or just feeling just very ill. Everyone I've talked to is like, yep, I will take the vaccine any day. So, you know, just know that this is the safest way, the safer way to build your protection to keep you and your family protected. Next slide. So we have 3 vaccines in the United States that have been approved for what you've probably heard the term emergency use authorization, or fully approved from the FDA. And so we have the Pfizer vaccine. The Pfizer vaccine is the one that is fully approved by the FDA, and it also has a brand name. So if you hear Pfizer or Comirnaty, those are the same vaccines. Then we also have the Moderna vaccine and the Johnson & Johnson vaccine. All 3 vaccines are safe and effective against serious illness, hospitalization, and death. So I know some people might say, well, aren't these vaccines supposed to protect us from getting it? Why are people getting breakthrough infections? The vaccines are here to make sure we don't end up in the hospital with severe illness or die. You know, vaccines are not 100%. You know, no vaccines are 100%. There is always, you know, that small degree of opportunity where you might get an exposure and get the virus. But we know it is highly effective, and we know that it's going to protect us from that serious illness, hospitalization, and death. And that is what our concern is for our community. We don't want people ending up in the hospital with severe illness and dying. So the Pfizer and the Moderna vaccines are a 2 vaccine series. So you need to have 2 doses to be considered fully vaccinated. And the Pfizer vaccine, the 2 doses are given 3 weeks apart. And for Moderna, the vaccines are given 4 weeks apart. And then Johnson & Johnson is a 1-dose series. So how do you feel when you get vaccinated? So what are these side effects that, you know, people talk about? So I don't know if side effects is the best term to use that you're having. People experience an immune response. So that immune response is exactly what your body is supposed to do when you get that vaccine. It is there to help your body learn how to fight off the virus if it is ever encountered by it. And so when you get the vaccine, you might feel some pain at the injection site. There might be some redness and some swelling there. You overall might feel tired. You might get a headache, some muscle pain, chills, some joint pain, fever, not feeling well, and maybe a decreased appetite. So those are some of the common responses that people have after they get their vaccine. But those don't last terribly long. They could last between 24 to 48 hours, and then you're feeling better. But that is your body recognizing the instructions and the information that has been put in through the vaccine, and that instructions are for the Pfizer and the Moderna. They use a technology called messenger RNA, mRNA. And what this is basically what they call a spike protein that is put in this vaccine. And it is instructions. It is a code to tell your body that, hey, when you see this COVID virus, this is what you need to attack. So that is part of the vaccine. And then the vaccine is made of other very natural, generic items like lipids, so fats, you know, salt, things like that. And once that goes in, that code tells your body, this is what you need to fight off. And as soon as that message is read, that messenger RNA, that message is read, it kind of is destroyed. So it doesn't even stay in the body that long for it to, do any other, if you want to say damage, go into cells, do anything like that, go into your DNA and change things. It's literally just a code, instructions to your body on how to make that, how to fight off that COVID virus. And then it goes away. And so that immune response is your body working, saying, hey, I recognize this thing. I know I need to fight it off when I see it. And so that's your body's reaction to it, the tiredness, the headaches, the muscle pain, the chills, those things like that. So when you're going through those things, your body is doing exactly what we need it to do to build an immune response, to start building those antibodies to protect you from the virus. In terms of safety, let me tell you, the vaccines are held to the same safety standards as every other vaccine that we currently use in the United States right now. Clinical trials were done on all of these vaccines. So the Pfizer vaccine, their clinical trials had over 40,000 people in it. Moderna had over 30,000 people, and J&J had over 40,000 people in each trial. So there were a lot of people that were participants in these various trials. They collected a lot of data, and the experts were able to recognize that through these evaluations of all of these people taking the vaccine, that it is safe for the community and the risks outweigh the benefits so that we can try to get through this pandemic. Next slide, please. So what about boosters? So we have one of our vaccines, the Pfizer, that has been approved for a booster for a little while now. And up on the slide is the criteria for folks to be considered for the booster. So why do we need boosters in the first place? What they're finding with the data is that over time, once people get their first vaccine series, they might have, or they might see some of the immunity wane over time, meaning getting lower and lower and lower. And so what the booster does is just give your body a boost, so it is able to recognize that the enemy again, that COVID virus, and be able to build up that immune system over again. So again, if you fit this criteria for people, our older population, again, remember their immune system, our elderly has been fighting for their entire course of their life. That's what our immune system does. It fights off germs, it fights off diseases, it fights off things. So as you get older, your immune system, just doesn't work as efficient as it might have been when an individual was younger. So they're a good population that might, that benefits from having a booster. And then we've also looked at, we have a lot of other people that because of their exposure to the virus, they see, because of their jobs, the nature of their work, they're in environments where they're exposed to the COVID virus, quite a bit because they're dealing around a lot of people. They would also be another population that might benefit from getting a booster. But what I would say is, again, on the slide are the criteria for people to be eligible for the Pfizer booster, but also have that conversation with your healthcare worker or other trusted professionals out there to make sure that you're making a good decision for yourself if you are considering getting a booster. Also, boosters for Moderna and J&J, again, the information and data and the approvals are changing so much, and we're getting new information all the time. So as of yesterday, Friday, the guidance or those experts in the FDA and the Centers for Disease Control have made recommendations and approvals for Moderna and Johnson & Johnson boosters as well. So probably in the next week or so, you will start seeing your healthcare facilities, maybe the hospitals that you guys use and go to, setting up plans and processes on how they're going to advertise and get people in to start offering Moderna and J&J boosters as well. So that, again, the news and the information is changing so much, but now it looks like we will have opportunities for boosters for all of the vaccines that we use in the United States. Next slide. So we've done a lot of talk about vaccinations, but we still have a lot of work to do. And we want to get more people vaccinated and layered up with this additional level of protection. If you remember earlier in the talk, it was mentioned that Black and Brown communities are the ones that are seeing more hospitalization and death when it comes to COVID. And unfortunately, they're also the ones that are seeing lower vaccination rates. You know, it is our Black and Brown communities that are lagging behind in getting vaccinated. So that's why I'm so glad to have this opportunity to talk to you today, because it's important to get the word out to the entire community so that people are getting updated information, have an opportunity to get questions answered, and we can support people with resources when they're ready to get vaccination so that we actually see the follow through and we can get these vaccination numbers up. Next slide, please. All right, so let's talk about some COVID myths. So I know there are some things out there that might be making people a little bit unsure about getting the vaccination. So we just want to go through a couple of myths quickly. First, getting the COVID vaccine gives you COVID. It cannot and will not give you COVID. The two mRNA vaccines, so the Pfizer and the Moderna, what they do is they have that M messenger RNA, and that instructs your cells to produce a protein that is part of or looks like the coronavirus, and that helps your body recognize and fight the virus when it comes along. The vaccine does not contain COVID virus. You cannot get COVID-19 from the vaccine. That protein just helps your body and your immune system recognize and fight the virus off, so that you're able to stay protected. If you've already had COVID, you don't need a vaccine. Again, we talked about this as well. We know that you get some level of immunity from having the vaccine, but we don't know how long it lasts or just how robust that level of immune response is. So the literature, the evidence, the research is telling us that getting vaccinated provides greater protection to others, since we know that the vaccine will also help reduce the spread of COVID. So what about, can the COVID vaccine affect women's fertility? So the COVID vaccine does not affect fertility. Actually, the vaccine encourages the body to create copies of that spike protein that is found on the surface of the coronavirus. It teaches your body's immune system to fight off the virus. And so what researchers believe that this confusion or this misinformation came about is because there was a false report on social media saying that the spike protein on the coronavirus was the same spike protein that's involved in the growth and the attachment of the placenta during pregnancy. And so this false report said that getting the COVID vaccine would cause a woman's body to fight this spike protein and impact her fertility. The two spike proteins are completely different. They're completely distinct. And getting the COVID vaccine does not affect the fertility of the women who are seeking to become pregnant. Actually, during the Pfizer vaccine clinical trials, they actually had 23 of the women volunteers. They became pregnant during the course of their clinical trials. So, again, none of the data supports that the COVID vaccine impacts pregnancy or fertility. And then the last myth we'll go quickly over is, does the COVID vaccine enter your cells and change your DNA? So the messenger RNA, so the spike protein that is part of the vaccine itself, does not enter the nucleus of the cell where your DNA resides. Again, that instructions, they go in just enough to teach your body how to fight off that virus, and then it is destroyed. It never reaches the cell of the nucleus. It cannot change your DNA. Next slide. So we need your help. We want you to really, if you're not vaccinated, consider to get vaccinated for COVID. And if you are vaccinated, consider getting your booster if you're eligible. And if you're still unsure, reach out to a trusted professional to help answer further some of the questions that you might have about the vaccine. So talk to your healthcare provider. You can go to a pharmacist. You can go to, some people might go to their clergy. There are a lot of churches out there that are talking about COVID education and are promoting the appropriate information and facts that are out there. So please reach out to those trusted individuals in your social networks and start having those conversations about the vaccine and talk about maybe some of the things that you're unsure about and seek out the correct answer so that you can make that informed choice. You want to keep practicing all of those other prevention methods that we talked about. And we are in cold and flu season. So I also recommend that if you haven't already done so, go ahead and get vaccinated for flu as well. It is that time of year of cold and flu season. Next slide. So here, I wanted to just leave with you guys a few resources that are out there for COVID testing and for COVID vaccination. So on the left-hand side are a lot of the various different counties or the district health department links. So there's a lot of great information on the DC Department of Health link. Prince George's County has information about their vaccination sites. Montgomery County has information about their vaccination sites and the hours of operation and times and phone numbers, as well as Fairfax County vaccination sites. There's plenty of resources online for you to find out where you need to go. You can go to your local CVS, Walmart. There are plenty of places that are searchable online for you to find either a link, a phone number on how you can schedule an appointment to get your vaccine if you're ready to do so, and where to get tested. And also the group that I work for, Mary Center, is there to help as well. So there's a 1-800 number up there, 844-796-2797. You can call there and get information about how to schedule an appointment at one of our various locations for testing and vaccination. Or you can go to one of our several sites that have walk-in locations for you to, again, talk to someone about additional information if you're unsure, or you can schedule that appointment as well to get vaccinated. So I'm really just thankful and appreciative for the time that I've had with everyone today. And with that, that concludes my presentation.
Thank you so much, Kyndra. It has been a pleasure to have you with us today, talking about such an important topic and issue that is affecting all of us. Partnerships such as the ones with Mary Center are critical to moving forward and ensuring that your United Way can meet the needs of the community and that together we can provide the best and most needed resources for the region. Thank you for attending today's workshop. To learn more about what United Way is doing to mobilize and make bold strides until we reach equity for all of our community members, regardless of race, gender, income, and ability, please visit unitedwaynca.org/PCC. Thank you.